Hello, and welcome to animatedteeth.com and our page that discusses dry sockets, their signs, symptoms, and appearance. Using this video, we'll highlight some of the primary points we cover that we feel you should know about when sorting through this subject. This page's coverage is divided up into a few subsections. Since it's usually the timing of the patient's symptoms that leads to making a diagnosis, we cover that first, and compare what's experienced to normal post-extraction healing. Then, while less diagnostic, we discuss the appearance of a dry socket and compare that to what's seen with normal healing. This page also explains why dry sockets form, how often this complication tends to occur, and how long it usually lasts. We should point out that this isn't our primary page that discusses treatment for this condition. We instead have two companion pages that cover that. One explains how dentists treat alveolar osteitis, the formal name for a dry socket. The other discusses the possibility of self-treatment. As far as signs and symptoms go, what's reported by the patient, and especially their mention of the timing of events, is usually the cornerstone on which a dentist bases their diagnosis. The standout characteristics of a dry socket are throbbing pain, which can be very intense, and possibly a foul breath odor. But the most important point is this. These symptoms don't start to appear until some days, usually 2 to 4, following your procedure. That's the key, the timing. To recap that point, with normal post-operative healing, the patient can expect that as each day passes, the discomfort they notice from their extraction site will gradually diminish. With a dry socket, pain levels will start to subside for a few days, but then start to ramp up. And an associated halitosis may be noticed. And if the person can see in their tooth socket, they will probably discover that it seems empty. The blood clot that was noticed previously now seems at least partially missing. Here's a comparison of normal versus alveolar osteitis in tabular form. In regard to discomfort, the classic description of dry socket pain is dull and throbbing. It may be constant or intermittent. Its intensity can vary, but at times may be debilitating. The pain may seem focused at your extraction site, or can extend into portions of your head and face. Unfortunately, there is no cure for a dry socket, it simply needs to run its course, which typically takes 4 to 8 days. In the meantime, the most effective means of controlling your discomfort comes from treatment from your dentist, so let them know you need help. If you can see into your extraction site, the classic description of a dry socket is one where the socket looks empty. If it doesn't, it may still contain a portion of the blood clot that had formed, or it may be full of food and debris. If you can see the socket's bony walls, they may be covered with a gray-yellow layer of necrotic debris. Your gum tissue around the opening will be red and puffy, which are signs of inflammation. With normal, uneventful healing, no exposed bone will be visible. The tooth socket will appear substantially filled in. At this point, you're probably wondering why dry sockets form. They're a situation where the extraction site's healing process is interrupted and therefore delayed. The crux of the problem lies in the fact that the blood clot that formed immediately following your extraction has become compromised, either disintegrated by chemical mediators or dislodged. And since it provides the scaffolding for the continued progress of the healing process, your socket finds itself back at square one, although now with exposed irritated tissues. While developing a dry socket isn't routine, it's certainly not uncommon. Comparatively more difficult or involved extractions tend to be more frequently associated with their formation, especially removing lower-impacted wisdom teeth. There are other risk factors too, including a previous history of having a dry socket, tobacco product use, possibly increased age and taking oral contraceptives, and, drumroll please, not following your dentist's aftercare instructions. Look for our supplemental page, shown here, that discuss these issues in more detail. There's a lot more information on this page than we've covered in this video, so make sure to read through it. However, as advice to you if you're currently experiencing a dry socket, by far it's your dentist's care that will be most effective in controlling your pain. So, as your extraction provider who is also obligated, and probably very eager, to provide you with postoperative assistance, be sure to take advantage of their services. Good luck.